Again, there are differences between each practice, and there are differences, of course, between everybody's insurance policy. So I'll talk about what I know and then kind of the right questions to ask depending on what your situation is. So right off the bat, some Trillium Health providers are Medicaid providers, and that's going to be have the lowest cost associated with it, of course, right? So Medicaid does not cover all of our services, and that means that we do have to charge a fee alongside that. For non-Medicaid patients, our fees typically range somewhere from like $5,000 to $6,000 for the full care, for prenatal, for labor and delivery, for postpartum and well baby care. Yes, midwives get to do well baby care for the first 6 weeks. So fun to see mom and baby together. So that's like $5,000 to $6,000 usually. The Medicaid will cover the vast majority of that, and then midwives charge a fee for those services that are not covered by Medicaid. So typically that's going to be like $700 to $1,200, depending again on the midwife. There are payment plans for that, so it's not like you walk in the door and you have to hand over several $100s. And we're working with some other organizations. We have the Trillium Collaborative, the nonprofit branch of Trillium House that helps with covering the fee for the facility here for lower resource people, and then working with some other organizations to help for people that would be a financial hardship to try to cover that. Privately insured, it's important to know that we're out of network with all private insurance. So if you have, Centra's health policy or Lynchburg City Schools health insurance policy or Liberty's, all of those we're out of network with them. Sometimes that means you're paying for the whole $5,000 to $6,000 here and not getting any reimbursement, and that can feel like scary and a deal breaker, and that is kind of heartbreaking to us, and we're still trying to work on strategies. So it's always worth asking if there are like discounts available or payment plans available, because that will always be a payment plan. Again, it's not just a one-time you hand over the money, it's finding a plan, and some midwives are more flexible than others. So I've had clients paying their bill 2 years after the baby's born. They're still just paying $100 a month, and that's what they can do. Some people can be really flexible. Most of us work with billing companies that will still bill your insurance even though it's out of network. And again, just depending on your policy, your deductibles and copays, sometimes that can significantly reimburse you after the fact. For some people, of course, that $5,000 to $6,000 falls under, if they have a high deductible plan, that falls under their deductible entirely. And so it's still an affordable option for them. And so some people choose midwifery care because of that.